So lipoprotein profiles. So lipoprotein profile means how much the cholesterol levels, how much the like a triglycerides. So we are going to found the different tests. So these are going to be cholesterol. So this cholesterol also is this test an important screening for the heart diseases. So especially if anybody get the atherosclerosis and also arteriosclerosis. So these cholesterol levels are going to be increased. So if you see this cholesterol, so different types of the cholesterols are there. So HDL, so that is the high density lipoprotein cholesterol, LDL, low density lipoprotein cholesterol. So and also we are going to found the triglycerides, high density lipoprotein, low density lipoprotein, and triglycerides. So these are the important and are markers, especially to rule out the heart diseases, such as in case in those like who are obese or who are having the triglycerides or atherosclerosis symptoms, or who have some symptoms related to the cardiac like abnormality. So these tests, if we do, we can find out the level of the cholesterol levels. So this one, high density lipoprotein cholesterol, is a class of lipoproteins produced by the liver and also intestine. And this is nothing but is the good cholesterol. So it should be is the normally 35 to 65 milligrams per deciliters in the men, and also 35 to 80 will be in the milligrams in the deciliters for the women. So at least should be minimum to minimum. Everybody should get this one is the 60 milligrams per deciliter is the normal. So if we have to increase the high density lipoprotein, if you want to reduce your heart attacks, so we try to increase this normal levels, but we have to reduce the low density lipoproteins. So these are called as the is nothing but is the low density lipo is the bad cholesterol. So up to 70 percentage of the this total serum cholesterol is present in the LDL. So most of the people who are like a high or like a atherosclerosis or obesity or cardiac risk factors, or if any like a fat heavy like a moderate obesity also. So the sedentary lifestyle or healthy, unhealthy diet. So these are all may chance to get the is increasing the LDL percentage, that is a low density lipoprotein. So if you see this one, the normally is 130 milligrams per deciliter is the normal. But if it depends upon the they are like a health status or physical activity and also healthy diet, so it may alter the this LDL levels. And also one more thing, who are having stress, anxiety, and depression also may affect the this LDL levels. It may increasing the cholesterol levels. So that also according to research articles, so it shows and proven who have like a high like a stress and also depression levels. So this lipoprotein is going to be increased. And also coming to the triglycerides. So these triglycerides also, so these tests are going to be is evaluate the suspected atherosclerosis and measure the body ability to metabolize the fat. So it's going to be, we can easily understand the, so how much of the fat accumulation inside the blood vessels is atherosclerosis means narrowing of the blood vessels because of the fatty plaques deposition in the blood vessels. So in these blood vessels, the blood layers, if you see the blood cell, like a blood walls, if you see the artery layers is going to be tunica intima inside layer, tunica media is the middle layer, tunica adventitia or externa is the outer layer. So these layers are going to become thickening. So what happened? The layers are going to be thick, and also because of the thickness, the lumen size is going to be decreased because of the wall thickness. If you see the blood vessel wall, the lumen size, inside content is going to be like a thick and narrowed. So it may give the atherosclerosis. It may produce the like the high blood pressure. So they may chance to get the high blood pressure. Because of this high blood pressure, they may chance to get the thrombosis because of the plaques, or this thrombosis breakdown may chance to get the embolus formations. Because of this thrombus and embolus formations, so many people may chance to get the cardiac diseases as well as may chance to get the cerebrovascular accidents, that is a stroke, may chance to get. So these tests are very, very important to diagnose the triglyceride, the bad cholesterol levels. So it should be less than the 100 mg per deciliters.